Michelle, can you check Facebook real quick?
Sure.
Make sure it reconnected.
It says waiting for live video. I will refresh.
Everything says waiting for live video. Maybe just hit refresh on your page.
Yep, it's back.
Yeah, we got it back. We're all good. All right, thank you. All right, bye. Want to do a mic check?
Okay.
Podium mic.
You betcha.
Podium mic and then count in Spanish to point.
Uh-oh. Podium mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Mic check. Test 1, 2, 3. Very good.
I don't think I can count to 20.
Uno, dos, tres, cuatro.
Yeah, I can get to 4. I could probably get to 10.
Testing. Adam, I can hear you, or I can see that you're on there. Can you hear me?
Yes, I can. Can you hear me?
Yes, I can. Thank you.
Awesome.
No, this was years ago.
The clouds are actually getting darker, but there's more space in between them, so that'll be fun.
Yeah, and it's brighter and darker, brighter and
Yeah,
darker.
exactly. Because the cloud right there is really dark, but then there's a huge open space right next to it.
I can hear you.
Isabella, can we do a mic check? Repeat after me. Mic check. 1, 2, 3.
Yes, can you? Mic check, 1, 2, 3.
Okay, just a reminder, anyone that is on the go-to meeting should take all questions from the phone and listen on the phone. There is a 10 to 12 second delay on the web.
Podium mic check, please.
Thank you.
Mic check. Mic check. Test 1, 2. Mic check. Test 1, 2. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Mic check. Test 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Mic check.
This should be good.
Live for 2 minutes.
At 30 seconds, I'll lose the slide.
Good afternoon. Dr. Tony Myers, Mercy Medical Center, Vice President of Medical Affairs. I thought I'd start by just giving an update on trends that we're seeing at the hospital at Mercy. Since we admitted our first COVID-19 patient a little over 3 weeks ago, and since then we've admitted 38 patients to the hospital. About a third of them have went home, and Actually, a little over a third have went home. An average stay in the hospital for those people that have gone home is 6 days. Some much shorter, a day or two, and some clearly, obviously, longer than that. A little over 30% of the patients that we've admitted have required mechanical ventilation. All of the efforts that both hospitals made to increase their ability to give ventilation was clearly important. If you look at the numbers we see on an average day, this is more than twice of what we would see during this time of year for ventilator use. So those extra ventilators were definitely necessary. We have the good news in that several of the people that were critically ill and on ventilators for a long period of time have actually been successfully taken off the ventilators, and one of them actually went home today, which was fantastic. As far as trends and what we're seeing from the numbers over time, and just looking at the last 10 days, what we're seeing at Mercy is that there's anywhere from 1 to 5 new admissions a day. For the most part, it's in the range of 2 or 3. And so if you average the last 10 days, we're seeing a steady about 2 patients admitted per day. Now, again, the patients that have been there are still there and haven't gone home have been there for quite a while. So even though 2 patients a day may not seem like too much, obviously that's 2 patients stacking up every day. That said, though, I'm very reassured by those numbers. That's completely within the capacity of both intensive care, ventilation, and just beds in the hospital as we map this out over the next 3 weeks. If we can continue to do this, then we should be in really good shape as far as critical care capacity goes until this should start to go down. I think the point of all this is that I'm very appreciative and thankful to the community. I know some people are doing social distancing better than other people, but the people that are doing it very well I understand how big of an imposition that is on their life. Canceling all these mass gatherings and closing businesses have had significant impact. All the social distancing we're so much better as a community and I think as a society and washing our hands. All of those things together are impacting the trend and the number of cases that we're seeing, and that's allowing the hospitals the ability to take care of people. Thank you.
Good afternoon. My name is Heather Metter, and I am the supervisor for the clinical branch services at Linn County Public Health. As of 1 p.m. today, there are currently 265 cases of COVID-19 in Linn County. There have been 20 deaths, and 97 individuals have recovered. As previously reported, Heritage Specialty Care is experiencing an outbreak of COVID-19. As of today, 102 staff and residents have tested positive. 17 of those residents have died, and 16 of the residents have recovered. We cannot report the number of staff that have recovered, as staff live in various counties, and we do not have the recovery information. The following is being shared with permission from Linn Manor Care Center. Unfortunately, 2 of the reported deaths are associated with Linn Manor Care Center in Marion, Iowa. Linn Manor quickly identified that 2 residents were ill and reached out to Linn County Public Health for guidance. Other residents that were showing symptoms of illness have been tested, and all tests have returned negative. 3 employees have tested positive and are following the CDC and IDPH guidelines for isolating at home. Linn County Public Health will continue to work with Linn Manor to monitor the situation and help provide guidance as the situation evolves. We know many people want to know how many deaths and how many cases there are in Linn County and are asking why the numbers do not match up exactly with other reports. Previously, we had released counts consistent with the governor's office. This is a fluid situation, and people continue to get sick, recover, and unfortunately die throughout the reporting period. Therefore, we are going to release the most updated information we have at this time. This information will not be consistent with the governor's 24-hour reporting period. If you would like additional information on the governor's 24-hour reporting period, please refer to the governor's office. Throughout the past week, I have personally noticed statements from people in the public and on social media commenting on the fact that they are over this and that this pandemic is no longer applicable to them. We have heard comments that people are young and healthy and do not need to worry about becoming severely ill. We hear that parents want their kids to go back to school because it's difficult to keep them at home. As public health professionals, we knew that this quarantine fatigue would be something we would need to address. I want to stress to you how vital it is to continue to follow the recommendations to slow the spread of COVID-19 in our community. The harsh reality is that many, if not all, of our lives have been impacted by this pandemic. Personally, my daughter is a senior at Kennedy High School. She will not have a prom and most likely will not have a graduation ceremony. As a nurse, I have friends in the healthcare field that are putting themselves at risk every single day to take care of those sick with COVID-19. We all are grieving the loss of our normal routines, the loss of school for our children, the loss of employment, the loss of social interaction, and for some, the loss of a loved one. Many people in our community are anxious, stressed, confused, angry. These are normal emotions to feel during this time of crisis. Currently, young and otherwise healthy individuals are fighting for their lives in hospitals. You cannot assume that you will not get just as sick as someone else because of your age or health status. We have heard the stories nationally of young people severely ill and on ventilators. This infection can strike anyone at any time. Our community is vulnerable to this infection. I want to take a minute to describe what will happen if we begin to let up on the actions we need to control the spread of the virus. We have community spread. Many of our community members have been infected, and some have recovered, and some have died. We are nowhere near reaching the point where we can safely return to normal activities without risking that this virus will cause people to become sick at a rate that cannot be handled by the healthcare system. This virus spreads quickly. If our healthcare system becomes overwhelmed and cannot care for patients at the appropriate rate, we may have deaths that could have been prevented. Every single interaction that you make has an impact on someone else. For example, if you have a child visiting at their friend's house, due to community spread, that child may unknowingly become infected and bring the virus home to their parents. Mom and dad then go to work and they spread it to their coworkers. This one play date may have an impact on dozens of people and perhaps lead to someone being hospitalized or even dying from this infection. Even with social distancing in place, the virus is not gone. We have to continue these measures. We will not return to normal soon. This is going to be a long haul. As we have stated, this is a marathon. This is not a sprint. We are all in this together. And if we all do our part, we can save lives until we finally reach the end of this marathon. Thank you.
This is the end of our prepared remarks for today. At this time, I would like to open it up for a few questions. We do have some media that are on the phone. Do we have questions? Looks like we have 3 questions. Who is our first question from? First question is from Kate Payne at Iowa Public Radio. Kate, go ahead.
Hi. This is a question for Heather Metter to start with. Could you just explain why Linn County's numbers may be inconsistent with the governor's numbers?
So Kate is asking why our numbers at Linn County may be inconsistent with the governor's numbers. Again, the governor is using a 24-hour reporting period, so I would ask you to contact the governor's office to find out exactly what that 24-hour reporting period contains. But again, this is a fluid situation. It's not like people get sick by 2 o'clock every afternoon and that's it for the day. People are continually becoming ill. People are continually recovering. And unfortunately, we have deaths being reported throughout the day. So the numbers are not going to be consistent. We're going to work really hard now to keep working to give you the most up-to-date numbers, even if they are not matching the governor's numbers. So I hope that helps to answer your question, Kate.
Okay, and so Linn County's numbers will be more up-to-date than the governor's, is what you're saying?
I would certainly hope so, yes.
Okay. And then you mentioned the idea that we're very far from being in a place where we can start moving back to normal.
Right.
Do we have an estimate for Linn County as far as when the peak will hit?
We won't know until
Any kind
after
of
it's...
estimate of when we should let up?
Yep. We won't know until after we've hit that peak, and I can't tell you when that peak's going to occur. That's what's hard about this virus, is the more we flatten the curve, what that flattening will do will help to take the stress off our healthcare infrastructure so that we can continue to take care of those that are sick. But as you flatten the curve, you also lengthen how long it's going to take to get through this. I don't have a date. I cannot tell you when this is going to end. I can't tell you when the peak's going to happen. The virus will dictate that. That's why we all need to be patient. We all need to continue to work together. And this is going to be a long time. But if we can have that patience, if we can continue to work together, if we continue to look out for our neighbor, not only for ourselves, we will get through this. It's just going to take time.
And one more question, if I could. We're seeing outbreaks at meatpacking facilities, at other larger manufacturers.
Yep.
Is Linn County working with some of those manufacturers in the county as far as screening employees, setting those kinds of recommendations?
That's a great question. So Kate is asking about outbreaks at manufacturing plants. So at this point in time, what happens here in Linn County, and again, I can only speak for Linn County, but when we find out that there's a new case and we find out where they work at, we contact that employer. So yes, we have contacted employers at various industries and manufacturers, not only in Linn County, but we've also reached out to those in other counties too, to alert them that their employee is ill. We do that with the employee permission. We alert them that they're ill, and then we help to provide guidance on them on steps that they can take to help keep the other employees that they have there safe and what they need to be looking for. So we continue to work with them. We will continue to do that. the Iowa Department of Public Health has put out new guidelines specific for the manufacturing industry. So that way, if there was an outbreak at a plant, that we could help them to do more testing, to do more screening, to help those workers, because we know that that has been an issue. We have seen higher numbers of illness come through those manufacturing plants.
Thank you.
Yep, thank you, Kate.
Our next question. Who does that come?
Caller has a question for Dr. Myers.
Repeat the caller's name.
Isabella Zaleski.
Isabella, go ahead with your question.
Hi, my question is for Dr. Myers. I was hoping that he could provide an update on the personal protective equipment situation at Mercy, especially in light of the Iowa Department of Health issuing an order last week to address current and anticipated shortages of PPE.
Thanks. Yeah, I can give a quick update. We're in a relatively good spot right now, and part of that has to do with the, as Heather said so well, the flattening of the curve and keeping the number of patients that are coming in and requiring intensive use of PPE down to reasonable numbers. So that clearly impacts it. We had already started a masking campaign early using cloth masks, and so the governor's statement about conserving PPE, we already had alternative PPE for visitors and also for people hospital workers that are not having direct patient care. So we were already using cloth masks, so it really didn't impact us that way. Preservation of isolation masks have been high on our list for a long period of time. And so what I would say right now, and again, this is kind of day to day always, but we are in a better position now than we were even 2 weeks ago. And part of that has to do just understanding how we're utilizing it, doing everything we can to decrease what's called the burn rate of that protective equipment, and just doing a good job with that and having some allocations that have come in from outside. Is there another question?
Nope, that's it. Thank you.
Okay, thanks.
Next is Adam Carroll.
Hi, I had a question for Heather. Heather, you said there were 2 deaths now at Linn Manor, as well as 3 staff members. By the governor's definition, Linn Manor then does not reach the threshold for an outbreak. Would you classify this as an outbreak at Linn Manor, and or are there any other precautions that the county can take once an outbreak is declared?
So the Iowa Department of Public Health has stated that manufacturing and industries, they are classifying an outbreak at 10%. However, for a healthcare system such as a nursing home, yes, I would consider this an outbreak because there are 5 individuals that tested positive, 2 of which have died. So we work with them on a daily basis. We also are in touch with the Iowa Department of Public Health, and we are working with them to help with guidance to make sure they have enough PPE, to make sure that individuals that are symptomatic are tested. So we will continue to work with them and help with guidance for them or any other nursing home that may be in the same situation until we feel that the issue has resolved. Does that help to answer your Adam, does that help to answer your question?
Yes, that does.
Okay.
With the Heritage case, have you begun to look into anything as to how it got this bad at Heritage in terms of the number of cases, the spread, and the severity of the case, in particular with that being such a prominent place that has so many cases and so many severe cases at that?
When we're looking at a nursing home, you're looking at individuals that are older and have multiple health issues. You are looking at individuals that live very closely together. And then you also have healthcare workers. And we know that healthcare workers are at high risk for contracting this virus. And so you have one area where you have people that are at high risk, both professionally and for people that live there. So unfortunately, a nursing home is just almost a breeding ground for something like this to happen because of the individuals that are there. And again, this virus spreads very quickly. So unfortunately, the virus had probably spread before we had realized what was going on. That's why we continue to work with them. We continue to work with the staff. We continue to look at PPE, the personal protective equipment that they need. We make sure that they have the testing that they need and give them guidance on everything that they can do possibly to help prevent the spread of this infection. But again, you just have a bad situation when you have people that live that close together, that are older, that have those other health conditions, and then you have the healthcare workers that are also at high risk for becoming infected, that are taking care of those individuals on a daily basis.
So when you have that perfect storm, is it just a matter of time before we have more nursing homes and more long-term care facilities that are in a similar situation as Heritage? Or are there things that we can proactively do or that are being proactively done?
There are things that are, yes.
Prevent that.
Yep, there are things that are being proactively done. We see that we are limiting visitors. When you look at most of our long-term care facilities, visitors are not allowed in there. And that's because every time a visitor comes in, there's a potential of bringing infection within that facility. So we're limiting visitors. We have them, the long-term care facilities are filling out surveys to let us know where their PPE is. They're also filling out surveys to let us know if individuals are sick, either staff or residents. So we are working with those long-term care facilities to be monitoring what is going on within those facilities so that we can help spot these issues earlier rather than later.
So does that include increased monitoring? Is there an effort to get more testing if there's one case to stop it from becoming many?
If we see cases of COVID-19 in there, yes, we will work with them on testing, and some of that testing may be outside the guidelines. That will be done on a case-by-case basis for the facility.
And so when you say outside the guidelines, that would be outside what would normally be tested? You might be doing more enhanced testing if there's even one case?
Correct.
I think those are all my questions.
Okay. Thank you, Adam.
Next question comes from Mary Green at KCRG.
Hi, my questions are for Heather as well. Earlier today, Governor Reynolds was talking about the Abbott testing machines that are coming to Iowa, and she said that some of them will be dispersed to long-term care facilities throughout the state. I was wondering if you'd be able to tell us if any of them, whether they're going to long-term care facilities or elsewhere, are coming to Linn County or if they're already here in Linn County.
I will be very honest with you, Mary. I do not know anything about the testing equipment. You know as much as I do, so I would reach back out to the governor's office and put that question towards them because I do not know. Dr. Myers, do you know anything about any tests? Yeah. So we have not been instructed of anything.
Sounds good. Thank you.
Yep. You're welcome. Thanks, Mary.
Just going to do one final check. Are there any other questions in the queue? One other question? And who does this question come to us from? Adam?
Yes, I did have one more question,
Okay.
Heather, with regard to long-term care facilities. We've seen in other states where county health departments have been able to shut down and evacuate long-term care facilities or a nursing home where there have been a high number of cases. Is that an option in Linn County? Is that an option with Heritage, or are there other circumstances where, or other actions that the county could take to kind of at the next level for this?
Anything is an option, and I don't think we would take anything off the plate. But again, we'd be in consultation with the facility, with the Iowa Department of Public Health, and with our local leaders to determine what would be needed. That conversation has not occurred at this point in time.
So there's no discussion to close down or evacuate Heritage by any stretch of the imagination yet?
No, there's been no discussion of shutting them down. They are working very, very hard and very diligently to care for their residents, for their staff. They have put every procedure in place that we have recommended. So we will continue to work with them on this. It is a very unfortunate incident, but they are working very, very hard to mitigate the situation.
And even though staff, like you said, are working really hard, doing everything you're asking to, you're still obviously seeing spread. Is there anything else beyond those recommendations and taking those steps that are possible steps at this point, or is that too early to say?
It's too early to say right now, Adam. Like I said, we're on the phone with them every day, monitoring the staff, monitoring the residents. And we have had residents there that have recovered. So we will continue to work with them to monitor those staff members. And as Dr. Myers had pointed out, individuals may be sick for a very long time. So we're going to see this there for a while just because the duration of illness is not just a few days. It can be weeks.
And so do you have any other nursing homes or long-term care facilities outside of Linn Manor and Heritage that have confirmed cases?
We have had other facilities that we have monitored, and no other positive test results have come from those facilities. So right now, there's no other facilities that we're working with, but we are monitoring all facilities within the county with the surveys that we are having completed each day.
Okay, thank you. I think I'm done for good now.
Okay. Thank you, Adam.
Okay, I think we have time for one more question from Kate Payne, and then we will conclude. Kate, go ahead.
Okay. So, Heather, again, I'm curious, with Linn having so many cases now, well over 200, have there been any changes to how you all are conducting contact tracing? And do you have enough staff to be able to be vetting each of those cases?
We are currently looking at our staffing situation to see if there are areas where we could make our staff more robust in contact tracing. But to answer your question, no, there's been no changes. We continue to do the contact tracing. And I think because of our contact tracing is why we have a higher number, because we are looking for those potential contacts to COVID-19. We are giving them the education that they need so that if they become symptomatic, if they become ill, that they know that this could potentially be COVID-19 and get tested. So part of our higher number may be because we're doing a good job at contact tracing and finding those individuals so that they can stay home, self-isolate, monitor themselves for symptoms, and then when they recognize those symptoms, they're calling their healthcare providers.
Okay.
Yep. Thank you, Kate.
This will conclude our press conference for today. Our next press conference is scheduled for Thursday, April 16th. I just want to briefly summarize the Linn County metrics that Heather shared as of 1 p.m. today. Linn County has 265 confirmed COVID-19 cases, 20 deaths, and 97 individuals that have recovered. As a reminder, please practice social distancing, wash your hands, and stay home when you're sick. Stay safe and stay home. Thank you.